Welcome to Psych Talk for primary care providers, where our esteemed faculty members will provide you with invaluable insights to seamlessly integrate into your daily practice. Today's guest is Dr. Justine Welsh. She talks about the best way to avoid substance use disorders.
Hi, my name is Dr. Justine Welsh, and I'm a child, adolescent, and adult addiction psychiatrist and director of addiction services at Emory Healthcare. I'm also the associate director of PCT. The majority of adults with substance use disorders begin using drugs and alcohol before the age of 18. The number one preventative strategy is to delay the onset of use. Each year an adolescent doesn't use alcohol or drugs is protective to their brain development. The earlier someone is exposed to substances increases the risk of problematic substance use in the future. The frequency of exposure, as well as what they are being exposed to, so for example, the potency of THC in the cannabis they're using, as well as other factors such as family history and environment, all play a role in the likelihood that someone will become addicted in the future. A conversation should take place with the adolescent about confidentiality and who will receive the results of any screening for substance use in a primary care clinic. Adolescents really want to know if what they're going to be sharing will get them into any trouble with their parents or caregivers. And not knowing what is disclosed may make them more likely to withhold information. Screening should also be age and developmentally appropriate. I often recommend the CRAFT and S2BI, or Screening to Brief Intervention, both of which are freely available online. If an adolescent patient is diagnosed with a substance use disorder, the majority of available treatment options are based off what we do in adults. Buprenorphine is the only FDA-approved medication with a pediatric indication, and that's for opioid use disorder in individuals ages 16 and older. Many of the medications, including for alcohol and nicotine use disorders, are prescribed off-label, often at the same dose and duration as in adults. I recommend that naloxone, the opioid overdose nasal spray, should be given to any adolescent who is using substances. Many other substances, including cannabis, have been found to be laced with highly potent opioids, like fentanyl, which can cause an unintentional overdose. Family members should also receive training on how to administer naloxone. Finally, it's really important to engage families in care whenever possible to support an adolescent. Outcomes are often improved when the family system is involved.